For things to change, we have to change. For things to get better, we have to get better. And it is all about woman's life getting better. And this is the saying said by world-renowned philosopher Jim Rohn. Hi, I am Dr. Loveleena Nadir, a senior consultant at Rosewalk Healthcare, Panchsheel Park. And today I will be talking to you about the importance of preconception counseling. Now, preconception counseling is a very nice concept because, pregnancy is a great milestone in a woman's life. And before you embark on this journey, there is a lot of anxiety and there's a lot of confusion. So it is always good to pay a visit to your gynecologist. And preconception counseling helps in many different ways. It helps to modify your diet and lifestyle before you get pregnant. It takes care of your current medication. That means, if you are on anti-diabetic medication, anti-hypertensive medication, for thyroid, for epilepsy, all that is taken into account. And then, we can review your pending immunizations. There are a lot of immunizations like rubella, hepatitis B. So it's a good idea to complete your vaccinations before one gets pregnant. And then, we can look at your pre-existing diseases and their control. Sometimes people are not aware and their blood pressure may be high, their blood sugar levels, their thyroid levels, everything needs to be monitored so that before they embark on this journey, everything is under control. And then we have to review or screen for any infections which are very common, like chlamydia or viral infections like toxoplasma, rubella, herpes, cytomegalovirus. So it has really a big role to play. And if somebody has had previous history of abortions or bad obstetric history, or there's a history of any abnormality in the previous child, or history of chromosomal abnormalities, then we can look into it and do a genetic screening, get a chromosomal karyotyping for both the partners. And from there we can go ahead and we can prevent whatever is preventable. So the preconception counseling really helps so that you can have a healthy pregnancy and proceed from there. So it's an important thing that you go for a preconception examination and an appointment with your favorite gynecologist. There are certain lifestyle modifications that a woman can do on her own. That is, before they are planning pregnancy, they should try to quit smoking, get off alcohol completely, as there is no safe limit of alcohol during pregnancy. One has to maintain a proper healthy weight. Now for that, a simple formula is for every inch of height, a woman should weigh 800 grams. So if you're 5 feet, your weight should be around 48 kg. Or we all can also say that your BMI should be between 18.5 to 20. So that means having a healthy pre-pregnancy weight. And we can take care of our diet. Diet has to be balanced, and global nutrition philosophy suggests that our diet should have 40% of complex carbohydrates, 30% of proteins, and 30% of essential fats. We should have adequate amount of green veggies and fresh fruits, which will give you complex carbohydrates, and the protein will come from dairy. The vegetarian sources are milk, curd, dals, lentils, paneer or cheese, and non-vegetarian sources are eggs, mutton, chicken, fish, but lean meat is obviously much better. So, it has to be a mix of everything. And of course, 80% role is of nutrition, but 20% role is of exercise. So nothing can change unless we combine the two. So one has to try to lead an active, healthy lifestyle with exercise and a balanced diet, and that will help you achieve an ideal pre-pregnancy weight. And of course, the complications would be much less during pregnancy. And we have to, also evaluate your partner, because before we embark or before you plan, we ensure that your blood groups are fine, and of course his sperm count is adequate, and one must start folic acid 3 months before because that prevents neural tube defects in the baby and also helps in the growth. And one must have adequate nutrients and supplements. So all that would be done by your gynecologist. So do visit a gynecologist before you embark on a very important milestone of your life, that is journey to motherhood. Thank you.